New polling numbers show most Australians are in favour of celebrating Australia Day on January 26. This year's poll shows every age bracket actually supports keeping Australia Day where it is on the calendar, which wasn't the case last year. Younger Aussies swung the largest two, up in support by 10%. For their take, let's bring in Employment Minister Murray Watt and Nationals MP Barnaby Joyce. Morning to both of you. Murray, let's start with you. We're being told almost 70% of Aussies support Australia Day being on January 26. Surprising result too from young Aussies, up to about 52%. What do you think? Should the date stay or the date change?
No, I think the date should change, Eddie, and that's exactly the position of the government. We've said repeatedly that we don't want to change the Australia Day date, and I'm actually not surprised to see that percentage of people in Australia say that we should keep the date in place. To be honest, I think most Australians are pretty sick of this debate that we have every single year. The opposition's not talking about changing the date. The government's not talking about changing the date. It's a bit of a non-issue, really, and I'm not quite sure why we keep having this debate every single year.
Well, it obviously is an issue because we do have the debate each and every year, and people are divided on this issue. That's still 52% in favour of young Aussies, but that's almost half that want it changed. Barnaby, what about you? I mean, you're in Tenterfield today. I imagine that there the support is very high, but in other parts of Australia, there is support for this date to change.
Well, I know it was a slip of the tongue, but I think if you play the tape, we started the interview with Mr. Watt saying that we should change the date, but I know that he didn't say that. Look, I think people are over having elites tell them how to run their country, deciding to make changes from an executive level. People who basically life has been very kind to, all of a sudden deciding it's in their remit to start suggesting changes to the date. The reason we have this debate every year is because people do run around saying that they want to change Australia Day to another day. When you look at it, it's a celebration or a commendation of convicts who came to Australia. They didn't want to be here. The soldiers who were protecting them or guarding them or locking them up, they didn't want to be here. The Aboriginal people didn't want them here. And from that very poor soil, this incredible nation has grown. And, you know, that is something to be commended. Like what we've created, one of the most egalitarian, I would say the most egalitarian nation on earth, from something that, if you look at it, of how the modern concept of it started, it should have failed, but it didn't. And I think that's absolutely worth celebrating. And the more people try to feel that they're being pushed around to change the date, the more they're going to say, no, that's the role of the Australian people at a referendum if you ever wanted to do it. You can't just arbitrarily do it because, you know, it doesn't fit your G&T afternoon.
And I mean, this report does come from the Institute of Public Affairs, so it's a right-leaning institute, but there is a significant change in those figures. Barnaby's right, Murray, at the beginning of the interview, you did accidentally say you did want to change the date. So just to clarify, you don't want to change the date?
Absolutely not. Sorry, I thought I said shouldn't, and I think you would have seen from everything else I said there that the government's absolutely not talking about changing the date, and we recognise most Australians want to keep it that way.
And hence the confusion. All right, moving on, a new report has revealed that almost 80% of available Australian GP clinics no longer offer bulk billing to adult patients, with out-of-pocket medical costs soaring nationwide. Murray, the incentive for bulk billing has been increased. What else can be done here to increase this bulk billing rate for adult Australians? Yeah, well, with the greatest of respect to Clean Bill, those figures are just categorically wrong. If you look at the surveys that the College of GPs conducts from their members, they say that the changes the government has been a game changer and has actually got more GPs to do bulk billing than what we've seen before. All of the official data that the Department of Health collects shows that there's now over 77% of GP visits are bulk billed, and that's up by about 1.5% just over the last year. So that's because of the changes we've made about increasing the rebates compared to what we saw under the Coalition, building those urgent care clinics, dozens of them now around the country. And look, I think most Australians can see that with the government, what you've seen is the increases to the rebates, the new Medicare urgent care clinics, and they look at Peter Dutton, a guy who was ranked the worst health minister ever by our doctors and tried to slap a $7 tax on every GP visit. So I think most Australians know that healthcare will always be cheaper under Labor, and that's because of the changes that we're making. Well, I think most Australians are really actually facing a really harsh reality in their households that they can't afford to go to the doctor in many cases. Barnaby, you're probably seeing this in regional areas particularly.
Well, in some regional areas, we can't, you know, in some regional areas like where I am here, times at Tenterfield, you can't get a doctor to the hospital. Forget about a doctor to the clinic. You haven't got a doctor to the hospital. We've got so many regional towns which just don't have doctors, where obstetrics is impossible. Muswellbrook, you can't have a baby because there's no, you have to either go to Tamworth, and even Tamworth at times has bypasses down to Newcastle. I mean, our health system is in crisis because in regional areas, because we just don't have doctors, and nobody seems to be able to do anything about it. And Senator Watt just saying, "Oh well, yeah, well the figures are wrong," and well that's not a solution. We actually live with this reality, and our reality is we don't have doctors. Not the doctors bulk bill or don't bulk bill. There are no doctors in so many areas. It's just, and that just means that there's two standards of living in Australia: one for in regards regional health and one for metropolitan health, and nothing the Labor Party has done has alleviated that at all.
Yeah.
Barnaby, it sounds like it might have been a mistake to freeze the Medicare rebate for the 10 years you guys were in government. That's what we've had to turn around. We've seen GP bulk billing in free fall under the Coalition. It is turning around under Labor because of the incentives that we're providing.
It's still in free fall, and you are the government. I can never work this out. When you talk to Labor Party people, they seem to refuse to accept that they're the government, that the responsibility is something that of years ago. They have been the government, you've had a run of it, and you've done a really bad job.
And bulk billing rates are going up. They're now up by 1.5% compared to what they were last year. I'm not going to pretend that every single Australian can get a bulk billed appointment.
And Murray is correct. The incentive for bulk billing has increased, but the ABS is reporting still that 1.5 million Australians can't get into a doctor and be bulk billed for it. Let's move on to a final issue today. Cost of living, of course, a big issue in Australia, a big issue for the election. Cafe owners have revealed that roughly 70% of the price for a morning cup of coffee is actually being eaten up by wages and power costs. Murray, the price of coffee going through the roof, lots of places. What's your reaction? Are you a coffee drinker?
I am a coffee drinker, probably more than I should be, Eddie. But look, I've noticed the price of coffee going up myself. That's partly because of the price of coffee beans worldwide going up as well. But this is exactly why we've worked so hard to try to bring inflation down, more than halving what it was when we came to office and providing all of that cost of living relief that Barnaby and Peter Dutton voted against. So things would be a whole lot worse out there if Peter Dutton and Barnaby had their way. But we'll keep working hard to help people with cost of living.
It's a good indicator, isn't it, Barnaby? You know, a cup of coffee that lots of people buy on a daily basis. There were reports in Adelaide over the break that it was gone up to $7. What are your thoughts on this?
Once more, Senator Watt and the Labor Party denying reality, denying gravity. The price of power's gone through the roof. And if you're going to run the nation on intermittent power, on swindle factories, wind turbines and solar panels, and this is not going to change. It's just, the person who wins this argument in the end is physics and economics. Physics that's just not possible. Economics that you can't afford it. And here's just another very small example. In a cup of coffee, it's just implausible that power is so much of the componentry of that cost. And the Labor Party just obstinately stands behind this ridiculous idea that they're going to run the nation on intermittent power, which really underpins their economic credibility.
Imagine what you'll be paying when you're paying for nuclear power. Your coffee prices are going to go nuclear under Barnaby. I don't think that's going to happen.
Look, you're the government. It's gone. The power prices have gone through the roof. You did it. You are the government, Murray. You are it, mate.
Barnaby and Murray, look, I hope you had a nice break over Christmas and New Year's where you didn't have to make these arguments. It's nice to see you back. First time, the same arguments again as we head into an election year. Thank you.
Good
We
to see you
appreciate
all.
your time.
Have a
Enjoy
great
a cup
day.
of coffee this morning. It's on us. Here's David.